So I think this has been a very, very big hiatus on my part. One second I'm uploading videos, next second I'm busy with my life, busy with my clinical practice and whatever and whatever. But right now, I think I have ample free time, and I think I'll be dedicating that to be in your service. Hopefully, you haven't forgotten me, this channel, Medman. Hopefully, I'll be able to bring this channel back from the pad. And what better way to be starting our, or rather restarting our medical journey than one of the most important core subjects, internal medicine. Internal medicine, so and so important, you know, I cannot even begin to emphasize on how important it is from a clinician's perspective, obviously, a physician's perspective, even a surgeon's perspective. As just a doctor's perspective, medicine is like 50 to 60% of everything that a doctor knows, for the most part, depending on what your specialty is. But medicine, everybody needs to have a grip on that. And what better way to start our internal medicine journey than starting it off with something amazing, which is gastroenterology. Now, gastroenterology is a very interesting subject, or rather an interesting specialty as far as internal medicine is concerned, because initially what we used to do is we used to include liver in gastroenterology as well. Now, let me make something clear over here. We are going to study gastroenterology from a physician's perspective, okay, from a clinician physician's perspective, so from an internal medicine perspective. Although I would argue that gastroenterology is more a surgeon's cup of tea, more of a surgical domain, because there is a lot to be discussed from surgery perspective, and we will do that, but later in a surgery module. Right now we are in an internal medicine module, and we'll only be focusing on the clinical points pertinent to gastroenterology from a physician's perspective. Not in this particular video, this is just an short introductory video to our modules that are to come, but later, in later modules. So liver, right now we don't include liver as a subspecialty under gastroenterology. We include liver as its own domain, which is hepatology. And hepatology is definitely more of a physician's perspective. It requires more of a physician's perspective. It is more of a physician's cup of tea. So what exactly will we study in this modules or in the videos that are to come? So the topics that we cover: firstly, diarrhea, malabsorption syndromes, inflammatory bowel disease, stomach, gastrinoma, and irritable bowel syndrome. These are extremely high yield topics, and these are topics that when we will be discussing them, although we are discussing this from a medicine perspective, we are not exactly making strict anatomy or strict physiology discussions on these topics. But when we'll come to the topic proper, to understand the clinical angle, to get the clinical insight, the clinical acumen, I will obviously be discussing the relevant anatomy, the relevant physiology points. So you don't need to worry about that. For example, when we'll be studying about malabsorption, we'll have to study about the physiology of absorption first. When we'll talk about inflammatory bowel disease, we need to know a little about the anatomy of the gut, the small intestine, the large intestine. Stomach, when we'll study about stomach, we will definitely be studying about the parts of the stomach, the anatomy of the stomach, not in a very detailed perspective, because that we'll be doing when we'll talk about the anatomy, proper anatomy of these individual parts. For example, the proper anatomy of stomach, the proper anatomy of small intestine. But whatever we need from a clinician's point of view to understand the clinically relevant points, the clinical anatomy, that is. So these are the topics that we'll be covering. And this time, what I'll be doing is, since I have just recently passed my MBBS examination, yay me, so now I will be appearing for my post-graduation examination next year. So for that, I need some MCQ practice as well. And so what we'll be doing is, after we cover these topics, or rather during our topic discussions, we will also be solving questions based on clinical scenarios. These will be multiple choice questions, and these will help in obviously furthering, cementing, adhering the clinical acumen, the clinical knowledge that we are gaining from the discussions that we have. So hopefully I'll be very, very, very excited if you do join me in our discussions. And we'll end this very short introductory video with a beautiful quote about just the medicine itself, which is: the practice of medicine is an art. It's not a trade. It's not a business. It is a calling in which your heart will be exercised equally with your head. And this is so true. This was said by Dr. William Osler, world-renowned physician. And this is so true. In our pursuit for medicine, we doctors, or we, whoever we are, as far as we are all connected to each other, doctors, nurses, healthcare professionals, in our pursuit for delivering our patients that adequate patient care, the treatment that they deserve, the debilitating condition that they are suffering from, and that relief that they get from our knowledge, from our treatment, that basically should be the crux of why we are in this field. Monetary, financial angle, and all of that, definitely, that is a big thing as well. But at the core of everything should be that satisfaction. And that comes from a proper, methodical, and objective analysis of whatever we are seeing in our patients. So with that beautiful quote in our mind, we'll be starting. Hopefully, I'll see you in my next videos where we'll talk about the upcoming topics. Thank you.